Well, here I am again for my twice-a-year Ocrevus infusion. And per usual, I'm being well taken care of by Jackie and Megan and Elliot and, of course, Dr. Graves. And, of course, that means it's also time for my biannual bitch session to remind folks that despite what you might hear on right-wing talk radio, America does not have the finest healthcare system in the world. We pay 2 or 3 or 4 or more times as much per person and as a percentage of GDP as any other economically competitive nation. And we get far less effective public health outcomes for all this money we spend. I want to take 2 or 3 minutes to expand on a point I made earlier, this time by explaining a little bit about how our competitors run their systems. And most of all, to dispel the stupid notion that by improving our system here in America, that means automatically we're going to move to some socialized medicine system. Well, first of all, we need to understand that despite these labels, in many ways we already have socialized medicine. For those who are very poor or disabled and some children, there's Medicaid. Just like for those over 65, there's Medicare. There's also health care for veterans supplied by the VA. So there is an element of socialized medicine in our system already. But for the majority of Americans, if they're covered at all, they're covered by a highly fragmented system of private insurance that features highly expensive requirements for employers to pay high premiums and their employees to pay high deductibles and high co-payments. For a lot of those employees, it's going to be highly probable that they will have to battle their profit-driven insurance company over the procedures and medicine that their doctor thinks they should have, but that highly paid insurance executives do not think they should have. Again, it's the job of these executives to get as much premium dollars coming in their policy or coming in their company and pay out as little benefit. That's the system we have. But it doesn't have to be this way. Other nations have found ways to provide their citizens, and I mean almost all of their citizens, with affordable and accessible health care. Now, Britain has closest to what can be called socialized medicine. That is their national health insurance. Taxes funded, the government operates most hospitals, and most treatment is free to the patient. But even in Britain, there are some examples of some limited private coverage for additional care, so it's not totally socialized medicine. Canada is different. The different provinces will act as the insurers for their citizens. Most doctors are independent practitioners. They're not paid by, they're not employees of the government. Patients ordinarily receive medically necessary hospital and physician care without any deductible or co-payment. That's how it is in Canada. Germany uses neither model. Germans enroll in a choice of mandatory regulated insurance funds. These are financed largely through employer and employee contributions. Now, the doctors and hospitals in Germany remain mostly independent. Again, they're not employees of the government. The patients generally face only modest regulated charges. Now, Japan is a lot like Germany in that it uses multiple insurance plans and mostly private providers. But the government sets a national price schedule, so doctors and hospitals cannot charge the radically different prices that you see here in America. Australia, down under, they have their own version of what they call Medicare, but it's not just for seniors, it's for the whole population. Patients can use hospitals without charge, while private insurance offers additional choices. It's a bit of a hybrid. Now, look, all these systems have real problems. There are higher taxes that their citizens pay, although those citizens have no expensive premiums to pay for-profit insurance companies. There are sometimes waiting lists in these countries for non-urgent and non-life-threatening care. You may have to wait longer, to get a facelift. There are going to be disputes as to how much government should pay versus how much individual citizens chip in. Those are the debates that go on in these countries. But every one of these nations seem to do something the U.S. can't. They guarantee to their citizens core insurance coverage that's affordable and accessible to everyone. But here, how much you and your family are covered for basic health care depends a lot on your job, your age, your income, what state you might live in, and what insurance company and contract you might have. The lesson here is not that there is one perfect foreign model that we should imitate. It's that America can achieve achieve affordable universal coverage in several different ways, including systems that preserve private doctors or private hospitals and even private insurance. But to do that, it will require that citizens make it a priority. This weekend marks 100 days until the most important midterm election of my lifetime. Now, I plan to ask every single candidate for every office how they plan to make sure every American has access to affordable, available, and accessible health care. I invite you to do the same. We've got work to do.